Hello friends, welcome to the AW Pharma Source, and my today's topic is route of drug administration. Route of drug administration is defined as the way by which drug can be given into the body. It is classified into the two types: local and systemic. Local is the route in which the drug can be administered at the site of action, and in the systemic route, drug is intended to be absorbed into the bloodstream and and can be distributed all over, including site of action. So first we will learn the local routes. In local, it is classified into the three types like topical, deeper tissues, and the intraarterial. In the topical, it is skin and the mucous membrane. Like the drug is applied directly to the skin and the mucous membrane. It includes the various types of creams, also the wigs, which is applied to the at the site of action. The second is the deeper tissues. In the deeper tissues, it is again classified into the three subtypes like the intrathecal. In intrathecals, the injection can be given through the CSF, like the cerebrospinal fluid. The second part is the intraretrobulbar, which is gives the drug at the eye side, like in the eyeball, which is for the inflammation purpose. And the third one is the intraarticulars, which is given in the bone joints, like in the bones, which in the bone joints between the bones contain the synovial fluids. Like the both intraretrobulbar and intraarticular cases, the drug like the hydrocortisone can be used for for the treatment purpose. And the third one is the intraarterial. In the intraarterials, in artery at the local part, drug can be given. Like the artery artery is defined as the in which the oxygenated blood from the heart can be provided to the various body organs or parts. And the second is the systemic route. Systemic route is again classified into the two types like enteral and the parental. In the enteral, it is again classified into the following types like oral, sublingual, intranasal, inhalational, transdermal, and the rectal. First one is the oral. Oral in which the drug can be given by orally. It is cheapest and the most common, and it is patient convenience. The second type is the sublingual. In sublingual, drug can be placed under the tongue or can be chewed in the buccal cavity, so spread between the cheek and the gums. In sublingual, liver is bypassed. This is the features of the sublingual route. The third is the intranasal. In the intranasal, the mucous membrane of the nozzle can be absorbed the various types of drugs. And the third one is the inhalational, like the volatile liquids and the gases can be administered the drugs. In which in inhalational, various volatile liquids and the gases can be administered, which is absorbed systemically. It is also in this also the liver is bypassed. Fifth one is the transdermal. In transdermal, the highly liquid soluble drugs is placed over the skin for the slower absorption. Like the various types of patches which contain the drug can be placed on the topical regions of the skin for giving the therapeutic effect. And the last one is the rectal. In rectal routes like the suppositories and enema can be used. This route is very useful or convenient for the geriatrics and like elderly and pediatric child patients. We are also in the case of unconscious patient. And the second part of the systemic is the parental. Parental refers to the administration by the injection into the direct blood streams without crossing the enteral mucous membrane. It is again classified into the four subtypes like intradermal, intravenous, subcutaneous, and the intramuscular. In intradermal, it is administered into the skin by raising the blade. Means skin को उठाकर उसमें injection through the injection drug can be administered. And the angle can be used in the intradermal, like the 10 to 15 degree. Second part is the intravenous. In intravenous, drug can be administered through the bolus, like injected through the bolus and like injection, and through through the infuse like a saline for 1 or 2 hours. 1 or 2 hours. The features of the intravenous like the 100% viability is, and it is very useful in the emergency cases. And the third one is the subcutaneous. In subcutaneous, like the various subcutaneous tissues, in subcutaneous route, drug is deposited in the subcutaneous tissues, which is highly richer in the nerves. And the last one is the intramuscular, in which the, the drug is administered into the one of the large intramuscular tissues. Drug can be injected into the tricep, again the deltoid muscles and the rectus femoris. So thank you, friends, to listening, and subscribe the channels and share the videos.